This is Abia COVID-19 update. Abia COVID-19 update. Well, it is still Abia State COVID-19 update, and of course, I do have with me in the studio the Honorable Commissioner for Information, Abia State Chief John Okiyekalu. He's back in the studio. He has been at the forefront of communicating the risk of this deadly virus to Abians, especially as far as risk communication is concerned. Honorable Commissioner, good morning to you.
Good morning, Michael. Good morning, wonderful people of Abia State.
Thank you very much, and you're welcome. As a responsible government, government is to protect Abians and, of course, protect our environment, of course, in view to preventing further community transmission of this disease. So we want to know what the government has been able to put in place to ensure that we put in check the spread of this new surge of COVID-19, particularly in Abia State.
Thank you very much. Short of reinstating total lockdown, all the relevant preventive protocols have been restored and enforcement will commence immediately. We have looked at the numbers. We are alarmed by the numbers, particularly with regards to those who came in from outside the country. Our advice is that if you had any contact with anybody that came back to the state from abroad, please immediately proceed to your local government headquarters or to Amachara, FMC, IDH in Abia, that's the Infectious Disease Hospital, or the General Hospital, to check your current status. It is free. The reason is that most of the new cases we are tracking came through people that returned from UK, from US, Malaysia, and the rest of it. We are alarmed by the number of new cases that are being recorded in the country in general and in the state in particular. The resources to manage these cases are available in Abia State. One of our findings is that this particular variant presents with otherwise unknown symptoms, like mere body pain, which wasn't a very strong consideration before now, and then by the time you try to arrest it, that person would have been far gone. The process of evolution of the pathology is faster than what we were seeing before now. And this particular variant that is troubling United Kingdom appears to be with us even now. So we are saying that our people returning from the celebration must go to the nearest local government headquarters or to Amachara or wherever they find clues to test. For some communities, we are relaunching community testing immediately. The epidemiology team of the Ministry of Health, led by Lady Peace Nwogugu, will be mobilizing to some communities from today.
Okay.
I am aware that there will be in Abreba tomorrow at the Rima Town Hall. That's my place.
Yes.
I also know that they will be going to some other locations in Abia North, South, and Central. The whole idea is to know your status right now so that we will be able to manage you back to good health as quickly as possible. And then if you are negative, you should take measures to protect yourself, and those measures include compulsory wearing of face masks when you are leaving your house.
We're very worried with the level of compliance in Abia State. It's very low, Honorable Commissioner.
You're right.
The zeal, initially during the first wave of the virus, we had, let me put it as compliance officers. Let me put it that way. Those that were out on the street to enforce this spread of COVID-19, and during this period also, Honorable Commissioner, we were able to put in place some of these measures by ensuring that those boarding tricycles do not exceed 2 at a time. That was when we had the transport fare go up by 50%. And by 100% anyways, 50 naira now, they're collecting 100 naira. The same thing, Okebekes and the buses. Now we have a fallback with those protocols now. Then people are not following those protocols at all. at all at this
Governor Okezie Ikpeazu has directed full enforcement by the Inter-Ministerial Committee on COVID-19. I am aware that the Secretary to State Government, who is the chairman of that committee, is mobilizing fully to commence enforcement from tomorrow. If you have any eatery and you are not in compliance, that eatery will be shut down. If you have a mall or a shop or even a church,
even banks
and other institutions where there is non-compliance will be shut down starting from tomorrow. Because of the ever-present risk that we are seeing now, we are going to redouble enforcement efforts for those who are keke riders who continue to flout the relevant protocols. They should expect to be enforced from tomorrow. The directive from the governor speaks to impounding such keke till we are sufficiently sure that this wave is over. So nobody is going to collect 10 naira or 20 naira from you. What we are going to do is to impound the keke and then park it somewhere so that you can't access it again. Same will apply to bus drivers and others who are non-complying with the relevant regulations. Yes, we are aware that a lot of people are no longer interested in doing what is right. It is not just about their life. We owe the elderly in Abia State the responsibility to ensure that they continue to stay with us. And because of that responsibility, we are going to make sure that those young persons that have refused to comply with relevant protective measures are enforced. The mobile courts are going to start operations on Monday, full operations on Monday, to ensure full compliance. Like I said earlier, short of a total lockdown, which we are not contemplating right now, every other measure launched prior to now won't be enforced in Abia State.
So this is a note of warning to those listening to this program. It's not going to be business as usual, especially from tomorrow, as compliance level will be high, as put in place by the Inter-Ministerial Committee on COVID-19 as set up by the governor. Now, we understand that there are public offices, ministries, departments and agencies, eateries, hospitals. They are meant to paste this no face mask, no entry inscription at the entry point of their offices.
Any of such offices that fail to do that will be shut down, including government offices, including government institutions, and then private institutions. If you fail to do that, provide hand washing materials. Ensure that people are sufficiently notified that they cannot enter without wearing face masks. If you fail to do that, starting from tomorrow morning, that facility will be shut down on the directive of the governor of Abia State, Dr. Okezie Ikpeazu.
I'm very particular about our churches now. When there is this sort of clampdown in quotes on churches, before you know it, say government is going against Christianity. Have you been able to liaise with the relevant unions like the Christian Association of Nigeria on sensitization and of course compliance with those protocols put in place during the first wave of the virus?
This administration does not contemplate a clampdown on churches. We will never clamp down on churches. There is no such thing as clamp down on churches. But we will continue to work with the people of God to ensure the safety of the flock. There are so many pastors that have gone down with this virus. Some of them have died from the virus, and I don't want to be put in that situation where I'll start mentioning names. No more here. I don't want to put in that situation. But let me say this. I was excited by the statement from Pastor Lukoya of Mountain of Fire Ministry, who told his people clearly that this is not a matter of binding and casting. It is a matter of doing the right thing to save your life. If every other man of God is doing the same, using the pulpit to sensitize the people on the danger, this is a real and present danger to the lives of the people of Abia State. Ensuring that even during service, during worship session, that people maintain adequate social distance. Presenting the people with hand washing bowls, soap and other relevant materials, including hand sanitizers where they can afford it. there will be no conflict with anybody. The government takes no interest in in enforcing these things in churches, because we believe that pastors are very responsible people. They are men and women who understand the signs of time, like the children of Issachar. And as children of Issachar, they should understand that this scourge has not come to stay, it has come to go. But for the moment, like the Bible said, let us lock down and allow this plague to pass. By locking down, I mean lock down your face now with a face mask. Ensure that you wash your hand regularly. Ensure that you stay away from the next person by maintaining social distance. Indeed, the church in Abia State bears a disproportionate responsibility to inform the people of Abia State on the present danger, the real and present danger that we are facing with regards to the pandemic COVID-19. Earlier on, you reeled out some of the prominent Nigerians that have gone down with this virus. What you have not done is to reel out the names in Abia State. I am constrained to continue to maintain what is seen as medical decorum. But we are also losing people here. That's the truth. Very prominent people. We are losing people. And it should not continue. The only way it can't continue is if we all do our bit to ensure that we comply with the fiscal measures put in place to protect us.
Okay, Honorable Commissioner, I'm so concerned about some of those necessities you put in place, the government put in place during the first wave of the virus at our various isolation centers. Are those things still in place? 24 hours provision of power supply and food for those patients that went down with COVID-19 and
absolutely
being treated?
Absolutely.
Indeed,
let me point out that as at today, we have enough resources to manage our people that come down with this virus. Even our isolation capacity is yet to be fully exploited. We have 100 bed space at Amachara that we have not used. We have bed spaces at IDH in Abia that we've not used. You understand?
I'm getting you.
Every night and day, the facilities are well run. There is steady power supply. We have drugs to manage people. We are not charging any money for testing, unlike other states. We are not charging any money for medical management of our patients. The only people that get to pay money for testing are returnees, and that is almost statutory as it is today. And indeed, what they will pay at Amachara is even cheaper than what they will pay at the private clinics. While the private clinics will probably charge around 50-something thousand, at Amachara they will pay 20,000 if they are traveling out for the first time.
Okay, driving this message at the grassroots level is very important. As it stands now, we have an edition of this program that runs in Igbo every Friday, and that emanates from our sister station, BCA FM. But we need to do more, Honorable Commissioner, getting the message to the grassroots, especially those at our villages and, of course, the hinterland. What is the government doing to ensure that we pass the message across to them?
All traditional rulers, executive chairmen, councillors have been mobilized by the Interministerial Committee to use all available channels to alert our people on the present danger that we are all facing. Beyond that, the Ministry of Information has launched new states of sensitization campaigns on radio, and we are going to work very hard with National Orientation Agency to see how we can even take it higher. But again, I will say this: the traditional channels are the most effective in this particular instance. The church is very key to the sensitization effort. We will continue to do what is necessary. The governor has provided all the required resources for us to ensure that we fight this pandemic and win the battle. We do not want to lose anybody again in Abia State to COVID-19. We also do not want our people to continue to go down with this strange disease. What we are saying is this: take responsibility for your personal protection and that of your family. If everyone wears face mask when they are outside, the effect is that even those carrying it will hold it on their own. without transmitting to others. And those who do not have it will cover their faces, and then they will not be infected. And as quickly as you are able to source for hand washing material, you wash your hand with soap under running water. Do that regularly if you don't have hand sanitizers. But if you do have hand sanitizers, continue to sanitize your hand. Importantly, please go and test.
Very important.
When I returned from the village, the first thing I did was to go to Amachara to submit my sample for testing. Everyone should take care of himself.
And it's returned negative.
Yes, it returned negative. And
state that.
Even with the negative result, I expect to test again at the end of this month. Because you have to go through regular testing, first to protect yourself, secondly to protect others. I am still young and strong and healthy. I don't want to be a healthy carrier of the virus that will spread it to elderly persons and kill them.
Okay, just before we wrap up the program this morning, I want you to put us through reveal what the government is doing to ensure that we have our own share of the vaccine being procured. We're expecting the vaccines in Nigeria before the end of January through the PTF at the federal level. What is the government doing at the state level to ensure that it's evenly distributed and, of course, well stored to avoid
Governor Okezie Victor Ikpeazu made direct contact with the PTF and the relevant Federal Ministry of Health officials regarding the provision of the vaccines for Abia State. In one of his tweets, he assured us that Abia will be one of the first states where the vaccine will be available. And of course, whoever wants, to be inoculated will have the opportunity.
It's whoever wants.
It's not compulsory.
Okay.
It's not compulsory. Do you understand that?
Okay.
There is no such thing as compulsory inoculation. If you feel that you require this vaccine, you should go for it. It's the same thing with other vaccines that are available. There is no such thing as
compulsory inoculation.
Yeah, but we will strongly support that everyone, gets the vaccine. But frankly, it's not compulsory.
Interesting. All right, thank you very much, Honorable Commissioner, for information. And definitely we want more on enforcement of some of this compliance, especially in Abia State. The compliance level is very, very low.
This is Abia COVID-19 update.
Abia COVID-19 update.